Our first item on the agenda today is a COVID-19 update from Mr. Bill Webb, the health officer here in Kent County, and Wayne Darrell, our director of emergency service. So, Mr. Webb, the floor is yours.
Good evening. I want to thank the commissioners for the opportunity to address the community. For anyone who is watching at home, I do have a series of slides. I will be talking to the slides. I'm not sure if you can see them at home. If you cannot see them, they will be posted at a later date on the county webpage.
They're there already.
Oh, they're there. Okay. Oh, well, how excellent. Okay. Okay, first I want to thank all of our partners in the Kent Emergency Operations Center. I especially want to thank Mr. Darrell, who pinch hit for me last month and gave this presentation on my behalf. I'm very grateful that he did that. But on to the update. Okay. I am distressed to report that Maryland's COVID-19 situation has deteriorated significantly since we last presented in October. Across the state, nation, and the world, SARS-CoV virus is surging. The Northern Hemisphere has now entered into the cooler months that are so conducive to the spread of this virus. Alarming reports about the latest metrics can be found on almost any news outlet. COVID fatigue among the public is real, and most have little patience for more government interference. Today, Governor Hogan scaled back capacity at most businesses. Bars and restaurants must now close at 10 p.m. Nursing homes must limit visitation to compassionate care only. Last week, he issued advisories discouraging travel outside the state and indoor gatherings of more than 25. He escalated hospital readiness levels, and today he authorized rapid patient transfers to hospitals with vacancies. Clearly, Maryland has entered a surge of COVID-19 whose severity appears quite extraordinary. In the last week, as my first slide demonstrates, we have marked several record highs in the new daily case rate. The next slide illustrates the corresponding rise in hospitalizations. Our state and our community needs to brace for the next round of this highly infectious disease. To date, Kent County has been spared from the most recent surge. Our time is coming if our vigilance wanes. The metaphor I like to use is that of tides. Kent County stands on the high ground. We can see the water rising, but we do not know how high it will go or how rough the waves will be. I'm here to warn everyone to grab their boots. The next slide illustrates the county's total case count since the start of the crisis in March. Since our last presentation, we have recorded 34 new cases. All were acquired through community spread. None were related to our congregate care facilities. Three involved members of the Kent County Public School community, and as of Sunday, we were tracking 16 active cases with 31 possible contacts. Unfortunately, late today, I have learned of a new outbreak at one of our skilled care facilities. More information about that at our next update. The next slide shows that 24 of the 34 new cases were recorded in the last 14 days. I'm happy to report that we have had no additional COVID-related deaths. Case totals by zip code are shown on the next slide. Population centers of Chestertown, Rock Hall, Galena, and Millington continue to record the highest case counts. One item that I failed to include with my slides that's worth mentioning is the new COVID-19 dashboard that was published last week by the Kent County Public Schools. This weekly information will greatly improve the public schools' transparency with COVID issues. I encourage all to bookmark this page. The next two slides illustrate Kent County's core metrics of positivity and case rates per 100,000 of population. These slides demonstrate the advantageous position of our county. The first one illustrates positivity. The pink line represents Kent, and Maryland is in blue. On Sunday, when I prepared this presentation, our positivity was 2.9. Today, it's 2.8. This value not only undercuts the state's average by more than 50%, it continues a recent pattern where we are consistently below the statewide measure. 142 of the last 153 days have been below this benchmark. Kent's case rate continues in a similar vein on the next slide. 92.8% of the last 168 days have recorded rates below the state average. This pattern for both these metrics bodes us well. I do caution, however, that they will fluctuate more widely than other counties. Cases in our small population can have an outsized impact on these metrics. The current situation in Garrett County demonstrates just such an impact. On the bottom of each of these slides, I have included important threshold values that will guide us with decisions about reopening and imposing restrictions. Currently, our public schools base their decisions to resume in-person education using these values. At this time, I do not feel that further restrictions are warranted, but we should be prepared if our numbers turn in the wrong direction and leadership from Annapolis is silent. My understanding is that the Kent County Board of Health would make these decisions. It is not yet convened during my tenure as the health officer. The next slide illustrates the ongoing success Kent residents have had in getting COVID tested. We continue to rank high on this measure. Contact tracings, on the next slide, contact tracing insights about the spread of the disease have not changed significantly since our last presentation. The slide illustrates that high-risk gatherings and locations in Kent County include family gatherings, religious services, work outside the home, indoor restaurant dining and retail shopping, and outdoor recreation. The weeks ahead will likely be the most difficult we have faced during this crisis. Hope is on the way, and it is seen in the form of vaccine development. Next slide, please. On November 9th, Pfizer announced that its vaccine is 90% effective against the SARS-CoV-2 virus. Modena Pharmaceuticals just yesterday announced 94% effectiveness with its product. MDH, Maryland Department of Health, has advised us to be ready to start dispensing in the next 30 days. We will be ready. COVID-19 vaccine deployment in Kent County will involve several phases. The first phase will give priority to first responders, healthcare workers, and residents of congregate care settings such as nursing homes, assisted living, and long-term care facilities. The Kent County Health Department will partner with Kent EMS to establish a point of dispensing at our Lynchburg building for healthcare workers and first responders. Residents of nursing homes will receive vaccine from providers hired by large pharmaceutical chains. Vaccine will be provided at no cost. It will be free. Once the first phase is completed, we will open appointments to those in the next priority tier. This would include essential infrastructure workers and those over the age of 65. Next slide, please. Vaccine difficulties. First, the FDA and other federal agencies have not approved any product for use. Several vaccines are now under consideration. The bureaucratic hurdles are anticipated to be cleared in 30 to 90 days. Next, the vaccine will require 2 immunizations separated by at least 21 days. This will require reminders and follow-up visits. The vaccine product is very temperature sensitive and has a short shelf life. It must be stored at negative 70 degrees centigrade, and it must be used within 5 days of defrosting. Next, recipients will need to register in an online appointment database to receive the vaccine. The CDC will only ship the product once we have a sufficient number of residents registered for the vaccination. Currently, the CDC plans to ship in 950 dose allotments. In Kent County, we anticipate having difficulty being able to register 950 recipients at a time. We are working with MDH and other local health departments to overcome this barrier. Our rural counties may need to vaccinate on a regional basis if CDC insists on a 950-person minimum. Community perception about immunization must also be addressed. Many have what's called vaccine hesitancy. They do not trust that the product is safe or effective. They want to wait and see what develops from those vaccinated in the first round. Vaccines save lives. This vaccine is the pathway to ending the COVID crisis. Next slide, please. Last week, the Maryland Department of Health released MD COVID Alert technology. It works using mobile phones to help identify if you have been exposed to someone who tests positive. Available on both Apple and Android phones, it uses Bluetooth radio beacons to track other phones that get closer than 6 feet. If a phone's owner subsequently tests positive, the system will send a message to all the other phones it came into contact with that they have been exposed to someone who's positive. This technology is truly groundbreaking. In the first 3 days, over 450,000 phones signed up for this service in Maryland. The governor reported today over 1 million enrollees exist. I encourage anyone with a mobile phone to activate this service. Next slide, please. As the Thanksgiving holiday approaches, I urge all to break with tradition. Please avoid large family gatherings. Do not travel over the river and through the woods to grandmother's house. Remember, the virus is aggressively spreading here and elsewhere. Many who are infected do not know it. Shop Black Friday online. The best gift you can give is the gift of health. Get a flu shot if you have not already done so. On my last slide, I provide an update on the Public Health Coronavirus Relief Fund spending. We have several items on the agenda later for consideration. These funds must be spent by December 30th. Currently, we have projected spending of $1.4 million of the $1.6 million allocated. The balance is being considered for a purchase that I think may or may not get mentioned later in tonight's meeting. In closing, Kent County currently sits in a good position relative to our neighbors. I am grateful to be a citizen of Kent County and the way our community has responded to this emergency. I caution everyone not to become complacent. We stand at a turning point. The COVID virus is outside, ready to spread mercilessly if we allow it. Our community's success will rest with the actions and personal responsibilities everybody takes. I urge all to please continue to wear masks. Stay at home if you're high risk. Wash your hands and keep your distance while socializing. Your efforts make a difference. These measures work. And in the words of the governor, he said, just wear the damn mask. Thank you.
Could I ask, I apologize, but could I ask you to repeat that about that cell phone again?
Okay.
I didn't follow you exactly.
Okay, so there's technology that you can enable on your phone that essentially the phone sends out, once you enable it, it sends out a beacon. And the beacon can only be detected by other phones that are 6 feet or closer. That's what Bluetooth technology is, a radio technology for very short distances. And it's able to detect other phones that are 6 feet or closer away. And what happens with that is that the phone just records other phones that it has come into contact with. And if someone tests positive and they have been using that technology, what happens is it just records the beacon of the other phones. It doesn't know who it is, and it doesn't know where it happened, but it can tell you when the beacon was, when you were exposed, and it can tell you that, in fact, you were.
I got you now. I understand. Thank you.
So is it telling you or someone else?
So it would be telling, it goes both ways. So say, for instance, you have it enabled on your phone and you subsequently test positive. What will happen is you'll get a code from the health department to enter into the application. It will then, communicate with the central servers that will then send a message out to all the other phones that had registered who had been in close contact. That's one direction. The other direction is it happens the other way. If your phone registers with another phone and they test positive, you'll get an announcement that you were exposed.
But you have to do something to your phone to make all this happen. So it's never going to happen on my phone.
You have to download the app, and I've put on there what the logo looks like. And if you go on to the Maryland coronavirus website, you can figure out what it's called and how to download it.
It's surprisingly easy, and
That's what my kids say, Bill.
that's
I'm just, I think it's a good thing, but
But when we were hiring these people, these tracers, in other words, if I got COVID, and they would go around and find out and contact all the people that I'd been in contact with. But this phone is actually going to give them that information.
well, no, it won't. The health department will have no.
No, but it'll give me it can give me the information of people that I was within 6 feet of.
Well, it'll just tell you when you were exposed. It won't tell you who you were, who was the person that was positive. It doesn't do that, but it will tell.
If I was positive, didn't you say that it picks up on people's who are with
Correct, and
6 feet or closer?
correct.
Now, can you go back and find out who those people are?
No, you can only identify. It's the beacon that's sent out is it's arranged to ensure maximum privacy of the.
It tells the other person that they were within
Correct.
6 feet of
And
me.
The only people that know that can tie the owner of the phone's name to the beacon signature is the folks who run the technology. That's not the health department. That is I'm not sure who the vendor is there, but it's very closely kept.
And it wouldn't say you were the person that was concerning. It would say the person had an exposure at a certain time.
Correct.
That's all the information.
Okay.
It'll say on Tuesday you were, our records indicate that you were exposed to someone who's been tested positive.
Okay.
So
Okay.
I did do it. You go onto the app and you fill out some information, personal information, and then you're assigned an identification number, and that's how you're associated.
So what kind of personal information do you have to put on there?
Your name, birth date, address.
Okay.
Okay.
I have one question on the vaccine. We've been hearing that the virus is essentially mutated. Is it possible that this vaccine has been developed for, I mean, I don't know, mutations, whatever they are, that this virus would have been for what was here in the spring, and now this, if the virus is mutated and it really is not going to be effective on a quote new virus. I mean, I don't know if the mutation is that extreme or not.
Well, I do know that several mutations of the virus have been documented. The effectiveness of each vaccine for each one of those, we don't know how effective that's going to be. Really, that information will come out when it gets the approval from the FDA and the other federal agencies. It is, in all likelihood, the vaccine, will be effective. Whether it will be 90% effective or 95% effective or 75% effective, we're only going to know that once we start mass vaccinations.
So it sounds like the vaccine is a good thing, but it may not be, if this virus isn't the same virus today that it was 6 months ago.
Correct.
Done now, like you say, might only be 75% effective versus 95, which is still better than what we have.
Correct. And that happens every year with the influenza vaccine.
Right.
And I have a feeling that may be the case here as well, but I don't have any evidence to support
We don't have
that.
any evidence of that at this point.
And all we've heard is that the one vaccine has to be kept at 70 degrees below Celsius or something, 0 or something.
Correct.
Where in Kent County do you have a facility that can hold that vaccine?
That's an excellent question, and the strategy there, because the ultra cold freezers that are used to store that are very expensive and they're in very limited supply. And the strategy we're going to use there is to keep the vaccine on dry ice. Dry ice keeps the vaccine within the appropriate temperature controls.
Ice will hold it at that temperature.
So is that similar to like a liquid nitrogen tank, or?
Well, liquid nitrogen is a lot colder than dry ice is, and
Is that too cold? Or?
that is too cold.
So it can either be too cold or too warm, man.
Correct. It's like Goldilocks, and what we have to do is when they develop this, they have very specific parameters, and they want you to keep it and store it at that cold that's where it's most stable, and as science develops, we may get a vaccine that's stable at room temperature. At this point, we don't have that, and we're trying to get what the pharmaceutical companies are able to develop out as quickly as possible, as long as it's safe and effective.
What's the availability of dry ice then? I mean, is that readily available?
That dry ice supply is anticipated to be in short supply. The good news is that Kent County has one of the few vendors here. I can't remember who the individual's name is, but it is. We're working on. In fact, we met today with this vendor to ensure the supply that we would need for Kent County.
How about that? And then once you take it out of there, you've got to use it within 5 days.
Correct. It still needs to be refrigerated, but you have to use it within 5 days.
So when you were talking about, I mean, you would want to obviously make sure that once you take it out, you've got enough people
Correct.
in a group that you can get rid of it as quickly as
Correct.
possible,
And
within
that's-
that 5 days anyhow.
That's one of the difficulties we may have, because the CDC will say, we're only going to, because they're controlling the shipments of it, we will only ship it to you once you have 950 people registered to get the immunization. And we're hoping that we will work together as a region to be able to, take a shipment and, one county gets a little bit, we get a little bit, and then we're able to, meet the vaccination needs that we have without, if we don't meet that need. Because 950, even at our, our drive-through flu clinics, we were doing about 140 individuals, per flu clinic. And, the estimate that I've read to vaccinate 950 people will take five nurses, 5 days, 8 hours a day of nothing but vaccination to do 950 people.
They can't do a drive-through, they have to wait 15 minutes before they can leave.
Yeah, what was that, Wayne?
They can't do a drive-through vaccination, you have to actually come in and sit down and be observed for 15 minutes before they can let you leave, to make sure there's no adverse reaction.
That was really like what they made us do when we had our flu shot. They wanted you to go sit down for a little while and make sure you were all right, had no after effects of it. But I guess like we do, like Chesapeake College is sort of a,
But why couldn't it even be, if it was Anne Arundel County or Baltimore County, you can transport it, correct?
Correct. And
So why couldn't the whole state be your region and get 950 and you would call and say, hey, we need 50 of them today?
we're working on that. And I think that a solution of that type will come together when the time comes.
All right.
Because what could, as far as the vaccine goes, there in all likelihood will be 4 or 5 different products available, and that if you get vaccinated with one product, you have to make sure that you get the follow-up vaccine of the same product. And that could be an additional complicating factor.
because it's a 2-shot vaccination, right?
Or
Within,
all
and the
of them are
second,
2-shot?
All of the ones that are being considered right now are 2 shots.
and you have to get the second one within 21 days. I read that someplace.
Correct.
Or no sooner than 21 days?
Well, Mr. Jacobs, you're right. It's no sooner than 20.
21 days.
So it's after 21 days you get your other one.
What do you feel is your probability of the percent of the people that will actually be in line to do that right away? Or there's going to be a high percent that are going to say, well, I'll let Joe do it and I'll see what shape he's in the month. I don't know.
That's a great question. I don't have a crystal ball. I do know that some specific agencies, first responder agencies, have been polled, and the interest in being one of the first to get vaccinated, it was, I think it was somewhere around 50% that were interested in getting vaccinated.
Even in your first responder group.
Correct.
Okay.
I can assure you I'm going to do it. I'm ready for this to be over.
Yeah, and
I'm signing up.
I'm going to get vaccinated, and I have a feeling that my picture with a needle in my arm will be posted on Facebook. So,
Bill, one other question? What do you think? What is the estimated percentage of these false positive with your test? When people go to get tests, you hear quite frequently in our little surroundings that somebody got a false positive. Is there a percentage that you estimate that they estimate that is a false positive? And if so, I'm just going to say if it's 20%.
oh, I don't think it's that high. I think
Well, is a lot of that you think could be counted in with those total numbers? I've had a couple experiences locally where somebody got tested, come find out it was a false positive. It does happen.
I don't have a number available for
I just wondered if maybe the federal government or something had some kind of an estimate of just how those tests run.
We're advised that if anybody tests positive, to treat to treat it as a positive.
No other choice. I understand that. I'm just curious of a percentage of how many people come back and find out they didn't have it to start with. That the first was inaccurate. What I'm saying, wonder what the percentage of the accuracy of those tests.
I don't have
No,
I can certainly get that information.
I don't need, it's not
Okay.
that important. I just was curious.
And I think, like Ronnie says, a false positive, and then they find out it was a false positive, is that taken off the tests that were positive?
No, in all likelihood, it's not.
So if you could figure there's 1,000 positive tests, that 20% of them probably aren't. I mean, I don't know. I'm just
It's the problem is it's very difficult to actually prove a false positive because we have so many people that are, asymptomatic. That is one of the hallmarks of an infection, and we have lots of people that have no idea that they're infected and they feel perfectly healthy, and so that.
So what actually then is a false positive?
Well, I can cite you one case that I'm familiar with. Where a friend of mine went to Middletown and was tested. They tested positive. But the very next day or 2 days later, they went to Chesapeake College and they were tested, and it come up negative. Then I think they got tested at your place and got a second negative. So they were tested 3 times within 4 or 5 days, and the first one was positive, the next 2 was negative. So it does happen, I think.
Oh, it does.
Is that a false positive, or were they at the end of their positivity, and now even one day was enough to make them negative?
Well, it's even more complicated than that because it can depend on the type of test that was used. That if you're using a point of care antigen test, which is a rapid test, that those tests because the timeliness is important, oftentimes are less accurate than the PCR tests that take several days to come back. And so, you could have, the natural pathology of the situation where, it's, you're getting better, you're tapering off, and, one day you're positive, the next you're not. Or it could be that, in the details of the type of test that was used. And, to be honest with you, I don't have that kind of background. I have to rely on the scientists that set this stuff up and do all of the validation.
Well, I think the short of the story is it's still here. People are still getting sick, and we need to be taking caution. I think that's I think that's what it's all about. Any other questions up here? Wayne, do you have some comments?
No, covered it all.
Covered it all? Okay.
Okay, thank you.
All right.
Well,
Thank you. We appreciate it.
President, Wayne, the information that we want you to look into, we have that because we want to do something before time.